Hi, everyone. Welcome to the GoldFish Report. I'm your host and researcher, Louisa. Today is Saturday, February 15th, 2025. This is GoldFish Report number 1138. And today is a special Saturday. We actually have two reports today. The first one is with vitamin D expert, Dr. Michael F. Holick. He is going to talk to us today about vitamin D's role in many metabolic disorders, but particularly Ehlers-Danlos syndrome. So welcome back, Michael. It was good to see you.
Nice to see you as well. I'll share my screen
Okay.
and I hope you're able to see it.
Not yet.
No,
Yeah, here we are. We've got it. We can see it.
good.
Yeah.
So, sorry, somehow we got lost.
That's okay.
So do this again.
I'm sorry, I should have also mentioned that Dr. Michael Holick is professor of medicine, physiology, and biophysics at Boston University School of Medicine. And forgive me for not mentioning that in the beginning, but this is our second interview together, and I think it's not our last either. I think we have a lot to talk about. So happy to have you join me today.
My pleasure. I think we're going to finally get this to work.
Looks good
Okay.
here. Yeah.
So thank you very much. It's a pleasure to be here. I'm going to be talking today, not very much about vitamin D because we did that the last time, and then we
Okay.
can another conversation at a later date. But I'm going to talk to you about the horrors of Ehlers-Danlos syndrome. It's a genetic disorder that you'll learn is extremely common, about 1 to 3% of the world's population. And I'm going to talk about the science and evidence perspective. So there's going to be a film coming out, and I'm going to show you a trailer of it momentarily. That's going to be at the Slam Dance Film Festival that you're able to actually see on the 24th and 25th of February. And this is the trailer that I hope you'll be able to hear and listen, watch and listen to.
So far, it's not activated.
Yeah, it's starting to, I think it's downloading.
Okay. Just so you know, I did click on it and it blocked me. It said it was private.
She was always a
Can't
really
see it.
strong kid. Then
Michael, I don't have
puberty.
the visual on it.
He went from playing, having fun, suddenly developed a very high fever,
don't
and
have the
that's
visual.
when everything changed.
It was my dream to be a great figure skater. That moment that I arrived at the hospital, I just walked right into hell. They didn't believe that my seizures were real.
A lot of doctors thought that I was just a young girl who wanted to get out of high school.
Ehlers-Danlos syndrome is a genetic disorder. There's at least 13 different forms, some which are very serious.
EDS is like earthquakes. You can have a 1.2 or a 6.4.
I have pain in every part of my body. I have 16 screws from the top of my head to the bottom of my neck.
A lot of doctors feel like this just can't be real.
You have a perfect storm for a doctor to sit back and wonder. I've heard about this medical child abuse where parents and patients are sort of faking their illnesses. Could this be that?
And it became very clear that they were suspecting medical abuse. Very quickly, these parents realize that the people they're dealing with are willing and able to take their sick child away. And it happens every day.
They say that we are doctor shopping, that I'm making up symptoms.
The proof against all the allegations, I can't see the end of it anymore.
All of my patients are scared to death that somebody's going to take their child away.
I believe that there are more people that have it. They easily can misdiagnose you.
Women are less likely to be believed.
They don't know what to do with these complicated cases.
Most of us have tried anything and everything to make ourselves better. I just want this to kill me already.
Where did I go wrong that she would be accused and I would be accused?
Okay. So are you there? We can stop screen share.
It's a hot summer morning in the Kayenta neighborhood of Ivins, Utah, when a Ring camera picks up a young...
All right, there we go.
Okay.
So hopefully that got your attention, and I'm going to be talking a lot about Ehlers-Danlos syndrome and many of the complications. So do you or your patient have these symptoms? Double jointed, touch the floor with the palm of your hands with your legs straight, feel lightheaded when you stand up quickly, bruise easily, joints click, sprain easily, flush easily, or sweat profusely without provocation, poor wound healing. Chronic migratory pains, dental crowding, high palate, papules, these little bumps on the sides of your feet that aren't explained. Women of childbearing age are at risk for high-risk pregnancy. Their infant and they can have gastroparesis, capillary fragility with a brain bleed, skeletal fragility, mast cell hypersensitivity. Adults can have what's called postural orthostatic tachycardia syndrome, which I'll talk about in a little while, migratory pains, early onset osteoarthritis, fragility fractures, among others. People worry about conflicts of interest, and I have none regarding this subject. Now, Ignaz Semmelweis, 1850, he was a brilliant physician, and he said, do not be bullied, basically, by the medical community. He introduced the concept of washing your hands before you deliver babies, and unfortunately, the doctors at the time didn't believe him at all, and as a result, they committed him to an insane asylum at the age of 40 and wound up having him beaten up, and he died 2 weeks later. He's now the most famous physician of Austria. They have a medical school in his name and a gold coin and a stamp. But at the time, nobody could appreciate how washing your hands could have any benefit as an antiseptic, basically, in improving the health of both a mom delivering her baby and the baby themselves. And so I've seen well over now 150 individuals been falsely accused of child abuse. Now, Mark Twain here, two most important dates in your life. One, birth date. And then the second, you may want to think about, right? But true, the day you realize the reason why you were born. It turns out that recently Meta Analytics did an analysis of 30 million detailed scholar profiles and concluded that I was number one in the world for vitamin D and for endocrinology and second in bone health. But there's a life-changing event that can sometimes occur because I was perfectly comfortable as the world's leading authority in the field of vitamin D and everything was going perfectly fine. Do what is right, not what is easy, nor what is popular. Frantic phone call I received in 2011 asking for my help. Family accused of child abuse, 10-month-old presented with fractures. I explained to the mom, I don't know anything about child abuse. I don't know how I can help you. And her response was, to know is to know that knowing nothing, that is the meaning of true knowledge, right? It's important to know what you don't know, right? And so she told me that she had read I'm one of the leading experts in pediatric and adult metabolic bone disease. There's no reason why you can't help me because my infant has fractures. We didn't cause them. We need to know why. And so in January 2011, I got to see her, her husband, and her children. The medical history for the infant. Joints were clicking, constantly spinning up, flushing without provocation, sweating profusely without provocation, has mottled appearing skin, bruises easily. 10-month-old had blue scleria on physical exam so that the whites of the eyes were bluish gray. Doughy textured skin with increased elasticity, joint hypermobility of shoulders, hips, partial subluxation, meaning partial dislocation of elbows, wrists, fingers, knees, and ankles, profuse flushing, so turning red-faced during the exam, and on listening to the heart had what's called click murmur syndrome. The diagnosis I made on this 10-month-old was Ehlers-Danlos syndrome hypermobility type. I appeared in the family court and explained to the judge that I don't know the family. I can't rule out non-accidental trauma as the cause for the fractures. But I explained to the judge that I'm the director of the Bone Healthcare Clinic for both pediatrics and for adult medicine at Boston Medical Center. I have 30-plus year history back then in working with patients with metabolic bone disease, had diagnosed by that time 15,000 patients and had seen over 2,000 infants and children with metabolic bone disease. And it was my expert opinion that the mother and her infant son had a genetic disorder that was associated with bone fragility that could cause the observed fractures. The child also was vitamin D deficient, and I explained to the judge how that can also impact. And so I concluded that this infant has this genetic disorder and that could be the cause for the fractures, including the vitamin D deficiency. And the judge dropped all charges. So mother and children, I continue to follow. And now to give you my background, right? I'm now professor of medicine, pharmacology, physiology, and biophysics. I'm director of the Ehlers-Danlos Clinical Research Program at Boston University School of Medicine. Right? Back in 1987, I was recruited by Boston City Hospital when it existed, and was asked to head up a bone clinic because of my expertise in pediatric and metabolic bone disease. I was also asked as to become chief of endocrinology, nutrition, and diabetes, and to run the General Clinical Research Center. I established the Adult and Pediatric Bone Clinic back in 1987 and introduced bone densitometry to the hospital. I now have 40-plus years experience of seeing patients with metabolic bone disease, diagnosed over 25,000, about 3,000 infants and children. I've been recognized as a top doc for almost more than 20 years in Boston because of my expertise. NASA, I had consulted for NASA, was on many of their review committees, Human Performance Committee in particular. I chaired some of their committees for research programs, and mainly because of my expertise in metabolic bone disease. So I'm considered one of the world's leading experts in infant and child metabolic bone disease. And Thomson Reuters in 2014 considered me one of the most influential physician scientists in the world. And Google Scholar recently notes that I've been cited more than 180,000 times. My research in vitamin D and metabolic bone disease touches the lives of hundreds of millions of infants, children, and adults worldwide. So now I'll give you the rest of the story. So brittle bone disease, turns out, was recognized back in the 1600s. 1840, it was finally given a name called osteogenesis imperfecta, meaning that there's some imperfection of the mineral of the bone or some defect of the bone itself, imperfect bone. An imperfect bone, osteogenesis imperfecta, increases risk for fractures in children and adults. Your bone is made of two major components, collagen and calcium and mineral. And so IOI, osteogenesis imperfecta, is that you have normal calcium, but you have a defect in your collagen. So here's what a healthy bone looks like inside. This is what's happening if you have osteogenesis imperfecta. And they know what the gene mutation is. So collagen is a major component of your skeleton, and they know that there are specific mutations in COL1A1 and COLA12. There's a genetic test for it. So if a child comes in with multiple fractures, or you have an infant with multiple fractures, you do this genetic test, it's positive, it explains it very well. And so it turns out that osteogenesis imperfecta is part of a whole host of genetic disorders that affect your collagen elastin matrix. And that includes Ehlers-Danlos syndrome and Marfan syndrome. So Ehlers-Danlos syndrome is defective collagen. What are the medical consequences? And so it turns out that it affects everything because your collagen elastin matrix is the scaffolding of your entire body. So it can affect your cartilage in your joints, making them hypermobile, can cause joint dislocation, can impact on bone health, can impact on your skin, increase capillary fragility, and have a whole host of other medical conditions. So joint hypermobility, for example, 10 times increased risk of fracture. So how does EDS cause these medical conditions? Well, here's a good example, right? So why do patients have so many problems? It's known as the jello phenomenon, okay? Jello, right? It's wonderful stuff, right? So it's made of collagen, just like almost everything, the scaffolding in your body is collagen elastin. And so if you build a structure in the beginning, say with collagen, it works and is structurally very sound. And so as a result, fibroblasts make the collagen, they cross the cross-linking, so it gives structural support. And so it's a major component of your skin, but it's a major component of everything in your body. And so typically your collagen is then cross-linked to give it structural integrity. It gives it strength. Less cross-linking, you have less strength. It's more pliable. And so here's a good example of normal collagen. And this is what it looks like if you have Ehlers-Danlos syndrome, that you have poor cross-linking and not as much collagen interacting. So it's a lot looser and more elastic. And so, like I said, it causes all of these very kind of obvious physical characteristics. So you may have heard, right? This is Ehlers-Danlos syndrome, right? Extremely rare genetic disorder. Medical students are taught for about 5 seconds. You'll never see this in your lifetime, not to worry. These are mainly the very people that are super elastic that can get in little glass boxes on American Most Talented programs, for example, or in rubber men and women in circuses. But it turns out not true. Right, here's Camille Schreier. She was Miss USA in 2020, right? She acknowledged, which was really important, did you know, that I have this genetic disorder. It caused her to have severe hip issues as a teenager. So hypermobile EDS, right? It's a heritable connective tissue disorder, and it's been suggested that up to 1 to 3% of the population suffer from it. And I can tell you from my own experience in the clinic, clearly this is a very common totally unrecognized genetic disorder by both the public as well as the medical community. Clinical consequences, like I said, joint destruction later in life, poor wound healing, gastroparesis, meaning you can't eat a normal sized meal without feeling uncomfortable. You have poor gastrointestinal motility. It can cause diarrhea. It can cause constipation. It causes all kinds of GI issues. Orthostatic hypotension. You stand up quickly and you can't constrict your blood vessels as quickly. And as a result, the blood drains out of your brain. You feel lightheaded. And as a result, your heart speeds up. It's called postural orthostatic tachycardia syndrome. You can have visual problems and you can have mast cell hypersensitivity, meaning that your mast cells, which are these immune cells that respond, for example, to a bee sting where you blow up like a balloon, right? These mast cells are unstable. They release histamine without any provocation, and people can have serious health consequences. They can feel embarrassed, for example, because they're flushing all the time, but there's also defects in their immune system as well that we've published on and others have as well. And fragility fractures. So how do I know about EDS and fractures? So you may be wondering, back in 2011 and 2012, when I first saw that first family, it turns out that when I was at Mass General Hospital, I had received my PhD degree and my MD degree, that I was interested in translating basic science to clinical medicine. And as a result, I set up a bone clinic as soon as I had completed my residency. And Dr. Steve Crane, who was head of rheumatology at the time, Principles of Internal Medicine is the Bible for physicians back then, asked me to co-author a chapter on osteoporosis and to talk about metabolic bone disease, and noted back then in 1980 that Ehlers-Danlos syndrome was well recognized as causing metabolic bone disease, increasing risk for osteoporosis and fractures. So building a bridge with steel rebar and concrete, right, you have a very stable structure. But if you have Ehlers-Danlos syndrome, it's a different story, right? It's like taking that steel rebar and now replacing it with plastic, because the collagen is much more elastic. And so now you have a structure that is very relatively unstable. Even if you put the same amount of concrete that you put in for a bridge that you built with steel rebar, any kind of force is more likely for it to crack, i.e. fracture. And this is what happens to the skeleton in a person with this genetic disorder. It's well documented that young adults, they take an x-ray of their spine, they have EDS, they find that they've had very tiny, multiple compression fractures that they never knew about. Previous fracture was 10 times more common in Ehlers-Danlos patients. EDS causes fragility fractures. So I was asked, because I started seeing a lot of families accused of child abuse due to multiple fractures, is to publish our data. So I went back to our clinical records and published a paper back in 2017, multiple fractures who have Ehlers-Danlos hypermobility type and or vitamin D deficiency, 72 infants whose parents were accused of child abuse. 93% of these children and adults, I got to see at least one of the parents in my clinic. I got to see at least 64% of these young children in my clinic. 93% had evidence of EDS, hypermobility type. 7% had evidence purely vitamin D deficiency rickets. The mean age, 12 weeks, right? And what's really remarkable, that 67 had clinical evidence of EDS. And like I said, most of the parents that were not aware that they had this genetic disorder. Site of distribution of the fractures. So it turns out ribs, femur, humerus, as well as a variety of other skeletal sites, all are affected by this genetic disorder. "67% of these infants, family history of hypermobility confirmed in clinic. They had a Beighton score, and I'll talk about this in a minute. They had soft tissue involvement, easy bruising, flushing, doughy textured skin, skin elasticity, joint hypermobility, and parents of the infants not seen hypermobility and have a Beighton score that was consistent with this genetic disorder. And we went on to show with the x-rays, here's a 7-week-old infant, father's in the military, right? Mother's 27 years old, is a native Alaskan American, previously diagnosed with EDS, multiple fractures. I testified for the family, and happily the judge accepted my recommendation that these fractures were fragility fractures associated with this genetic disorder. So I've connected the dots. I've observed and published that skeletal fractures are documented in adults, and it's also present in infants with this genetic disorder. Ehlers-Danlos syndrome is like osteogenesis imperfecta. It's associated with fragility fractures in infants, children, and adults. There's no genetic test, right? And as a result, I have an Ehlers-Danlos clinical research program where we do invite whole families, up to 4 generations, to see us. We do a careful physical exam, medical history, and we get a buccal swab for their DNA. The diagnosis can only be made by a medical history and physical exam. And a Beighton score. So what is this? So Dr. Beighton many years ago decided that if you have joint hypermobility, how do you know if it's really related to this? And so if you have hypermobility of your wrist, where you can touch your thumb to your wrist, or you have hypermobility of your elbows, or if you have hypermobility of your 5th digits, touch the floor with the palm of your hands, hypermobility of your knees, each one is a point. And if you have at least 5 points out of 9, it's consistent with this diagnosis. And so here it shows it nicely again to look for hypermobility of the knee, of the 5th digit, of your wrist, of your elbow, and of your spine. And each one is a point. And each joint is a point, so as a result, the total is 9. So this is healthy bone. And this is what happens when you have osteogenesis imperfecta and Ehlers-Danlos syndrome. The smoking gun case, finally, 15-year quest. 2017, orthopedic surgeon asked me to see a 32-year-old female patient evaluated for poorly healed right upper arm fracture. My diagnosis was that that young woman had Ehlers-Danlos syndrome, probably one of the reasons that it didn't heal as well. I put her on a very special bone active medication. And I told her, if you get pregnant, stop it and call me after your pregnancy and I'll put you back on. She did become pregnant, stopped the medication. And so then I called her after she had called me 8 months later. And she told me that her son in utero had fractured both arms, both legs, and most ribs. Her son had 23 fractures in utero. The diagnosis that was made was osteogenesis imperfecta. The hospital, Boston Medical Center, obstetricians apparently and pediatricians did not read the medical record that I had on this mom, where I had documented that she had this genetic disorder. And here's the x-ray of this infant after birth. Here for the ribs, for example, multiple fractures. And here is the humerus in utero, right? And here you can see again a fracture. Col 1A1 and A2, they were found to be normal. So therefore, this child did not have osteogenesis imperfecta. So we did a buccal swab. I got to see the child and mom and dad, and we did a careful medical history, physical exam, and we did a whole genome sequencing on mom, father, and infant. And we found a gene that is related to severe bone fragility. And it was homozygous for this gene, CCDC134. And so we did publish this child, first ever demonstrated EDS can cause in utero fractures. Now think about this. At 7 weeks of age, can you imagine if she had brought her son in, they didn't know that he had fractured in utero and had pneumonia and then had an x-ray taken, right, of the chest? They would have found multiple healing fractures of his rib cage. They would have done a skeletal survey and found his legs were fractured, his scapula were fractured, his arms were fractured. They for sure would have concluded there's no other reason that could be than child abuse, especially with a negative test for osteogenesis imperfecta. So this demonstrates that if you have a child coming in with fractures, you don't only have two choices, which is typically what child abuse experts have, which is either A, they have osteogenesis imperfecta, or B, that it's due to child abuse. And we've found there's at least a third, and there are a multitude of other genetic disorders that can cause bone fragility. And so the diagnosis is Ehlers-Danlos syndrome hypermobility type. Cannot be made under the age of 5. This is what's recommended in 2017 by the Ehlers-Danlos group who put out their recommendations. To me, this defies all logic because these infants are prone to fractures, as we've demonstrated. They're prone to flushing without provocation. They're prone to gastroparesis, meaning that they often are spitting up their breastfeeding or their infant formula feeding. Why? Because their stomach is very stretchy, just like everything else in their body. They have what's called dysautonomia, which is a defect of their sympathetic and parasympathetic nervous system. So what happens as this infant is feeding, the stomach is blowing up like a balloon, and it can't push the meal down into the intestine, and as a result, it collapses and they spit up. And they're often misdiagnosed as having gastric reflux, when in fact the simple fix, and that's why it's important to make this diagnosis, is to give much smaller feedings multiple times a day to give them the same amount of calories and nutrition. And so, important, make a diagnosis of HEDS as early as possible. Now, you have this infants are born with HEDS and have medical conditions that need attention. Like I said, gastroparesis, misdiagnosed as gastroesophageal reflux disease. Capillary fragility associated with easy bruising. Why is that important? Because if they bump their head in a significant way, they could wind up bleeding in their head that can lead to serious consequences, including neurological deficits and even lead to death. The joints click due to hypermobility. They need, a helmet. I always warn parents that they need to wear a soft helmet at least and a hard helmet, especially if they're beginning to crawl and walk. Typically, we find that because of the laxity in the joints and they have hypotonia, decrease in muscle function, that usually takes them a longer time to begin to crawl and to walk. And because of the instability of the ligaments in their ankles. They often will walk on their tippy toes initially in order to stabilize their ankles so that they can walk. Joints click due to hypermobility. They need physical therapy. Very important for stabilization. So like I said, delayed crawling, walking due to joint laxity and hypotonia. Dysautonomia, like I said, can cause gastroparesis and can cause a whole host of other medical problems, especially later in life, and mast cell hypersensitivity. Often these children are taken to an allergist and they're treated for all kinds, or at least evaluated for all types of allergies, and often conclude that they're allergic to everything. This is mast cell hypersensitivity and not necessarily related to a specific allergy. And like I said, bone fragility. Mom takes baby to ER for mystery bump, then spends 550 days trying to get her daughter back. This was in People magazine. And it says, I've done so much research. I found this article. It was 72 infants studied that had fractured bones, metabolic bone disease, like issues, but they all ended up with Ehlers-Danlos syndrome, she shares. Found a list of professionals available, among them me. Kaylee reveals he got back to us less than 24 hours, sending over paperwork, family medical history for the couple to gather before appointment that I got to see. And then I got to see the child, and we tested mom and the child, and all three had significant Beighton score. I had 8 of 9 markers. Rowan and my mom had 7 of said Kaylee. And there she is with her daughter that I was happy to be able to help. Military couple takes twins to ER for injury. 500 days later, they're still fighting to get them back. They were looking at somebody else when really it's underlying medical issues that were being addressed. To have Dr. Holick actually address it and validate it and write up a report, I was extremely relieved. Reviewed our case, said we were good candidates to be evaluated. We got approval to get the twins up to Boston and ultimately made the diagnosis. And here's the family, but they're still fighting in some of the courts to convince them that this was due to this genetic disorder, bone fragility, and not due to child abuse. So here you have a 16-year-old teen girl complains to her pediatrician. She flushes easily. She just feels terrible. She sweats profusely. Her joints ache all the time. I feel lightheaded when I stand up quickly. My heart beats fast in my chest. Doctor says, just drink more water and it'll help because you're dehydrated. And of course it doesn't. I have migratory pains. I have severe constipation. I have severe diarrhea. My joints click. The diagnosis often is Munchausen by proxy. Why? Because the pediatrician can't understand how it's possible you can have so many disconnected diagnoses associated with one diagnosis, i.e., Ehlers-Danlos syndrome hypermobility type. And so I'll leave you with this final message. Here's Karen Richards, beautiful young girl, super enthusiastic, looking forward to a long and happy life. At age 9, she wound up having recurrent shoulder instability. At age 10, she had joint laxity and hyperextensibility. Age 12, she wound up having surgery, tethered cord release surgery. She wound up with a fusion of her C2. She had idiopathic intracranial hypertension. And only by the age of 17, after all of these issues, first thinking that she was faking a lot of this, they made the diagnosis of Ehlers-Danlos syndrome hypermobility type. She had ankle pinning at the age of 11, right shoulder reconstruction at the age of 12. And it's really amazing when you read her medical record, because it says, surgical team concerned about compliance. They thought that when they tried to fix her shoulder, that she was intentionally trying to dislocate it. There's, like I said, tethered cord release surgery, C fusion, and this idiopathic. And multiple GI problems, including bloating, nausea, vomiting, severe constipation, mast cell activation syndrome. By age 22, feeding interventions, including gastric tube placement. And then she had immune dysfunction. And here is Karen. Karen Richards, again, LP shunt, cervical discectomy, vascular complications, GI problems, and a whole host of other issues. She had dysphagia, vocal cord paralysis. Why? Improper size surgical hardware. This poor young woman. Relentless progression, advanced HEDS. It was so debilitating for her that she decided that she had enough. And as a result, went into hospice. And she passed at age 24. But she was heroic because she decided she did not want to die without maybe helping science. And she wanted to have her body donated to science. And I got the phone call and was asked to be in charge of her when she passed and to do as much science and as much investigation as we could to uncover what it was that she was going through. Why was that happening? And can there be a good genetic explanation for what she went through? So she basically donated her body to me. I made the arrangements, and she was brought to Boston Medical Center, and I participated in the autopsy with Dr. Shervani because we wanted to make sure that we could collect the tissues properly, store them properly, so that we could meet her request, is to use all of her body as best we could to serve science. Post-mortem findings, we found in her brain that she had Alzheimer type 2 astrocytes. Now, typically these are seen in chronic illness, especially with liver disease, but she had normal liver function. And we've seen patients, especially young women with this genetic disorder, that often complain of confusion and of brain fog. And we're now beginning to believe that this is in part maybe due to what's going on in the brain that we identified in Karen. Post-mortem finding, and sorry for this picture, but I want to make the point. Here she is being followed by variety of medical specialties. She died ultimately of impaction, of constipation. 70% of her colon was totally impacted. I find that very distressing. That poor woman suffered enormously. Now we went ahead and we had some gene sequencing for her, and Dr. Shervani and his son found that she has a genetic defect affecting her ability to make ATP, right? Which is your energy source utilized by your mitochondria to keep everything going really well. This can certainly explain a lot of the symptoms that she was experiencing and that a lot of patients with EDS experience, including severe fatigue and unable, to function sometimes. So you may ask the question, why would I engage in this work given the personal cost? Because what I didn't tell you was, as a result of my activities, I was ultimately terminated by Boston Medical Center. I don't charge for this expertise because I didn't want to burden these families, in my opinion, falsely accused of child abuse. I've testified for well over now 100 families, helping them be reunited with their children. And I think the reason that I can give is really best said by John Lewis, right? He said it best. Why have I been doing this for the past 15 years? His philosophy was very simple. When you see something that is not right, not fair, not just, say something, do something, get in trouble, good trouble, necessary trouble. When you know something is wrong, you are obligated, he said, you are obligated to help make it right. And I felt very compelled to do that for the past 15 years and continue to do so as long as I can. This really, I think, gives a good insight into what I think is going on today. Here, 1860, Arthur Schopenhauer, he's first European Buddhist. What did he say? I will leave you with one last thought, right? All truth passes through three stages. One, it's ridiculed. Definitely, I've been ridiculed for what I've been doing. And then it is violently opposed. And that's the stage I'm in right now. And then finally, it's accepted as being self-evident. And I'm confident, especially now with the movie Complicated, it will open up the eyes of the public and hopefully medical community to realize that children, teenagers, adults complaining of multiple symptoms, they need to be evaluated for this very common genetic disorder. July 19th in 2024. Hello, Dr. Holick. I was given your info family and consulted to you for fractured families. My husband is being accused of child abuse and wanted to know if I could help. I got to see the family. I spoke to her, right? And based on the evaluation over Zoom, and then she filled out a questionnaire, there was no question, in my opinion, that she and her child had this genetic disorder. So the bottom line, I ask you, what would you do? Right? Would you give up everything if you know something is wrong and you need to make it right? You have the expertise to do so. That's what I've been doing. And I hope you have a chance to watch this movie. It's going to be shown at the Slam Dance Film Festival. You can go online to get to see it. I'll be giving Louisa the information that she can put on her website so you can get to see the entire movie. And I'll also give her the new updated version for the trailer that you can get to see. I need your help. I do. I need your help. And if you're able to support me emotionally, financially, you can go to my website, drmichaelholick.org. And I want to thank you very much for your kind attention.
Well, I want to thank you so much for your time in preparing this. And I want to also, I have a few questions, if you don't mind, if you have a few minutes.
By all means, I'll stop sharing.
Okay, yeah, that would be good. What I want to do though, before, let me see, let me get to the right website that I have here. I wanted to show the website, the website with the, here it is. Here it is. Okay. And the one where you're so you're going to be running the Boston Marathon in honor and memory of raising awareness for Ehlers-Danlos syndrome, and of course these beautiful girls whose lives were cut short, losses cut short as a result of this syndrome. let me see if I could find that page just while we're talking. I'll look for it. But in the meantime, my question is this: is it can an I guess a quicker genetic test be made if you had the funding?
But that's the problem. There is no genetic test.
You really
And
can't.
we're trying to raise funds. And if those are interested, I can give you a website for my Ehlers-Danlos program at BU. It's a tax-deductible program. We're on the hunt to understand the genetic cause. We found in Karen one of the causes for many of her symptoms, but no one has figured out yet what is the genetic marker for this genetic disorder. That's why you have to have a careful physical exam and careful medical history taken.
Okay. Is this related to, I guess it is, but is how big of a role does vitamin D play in this? Do you know?
Vitamin D plays no role in this at
Oh,
all,
not at all. Okay, I
but
see.
but but
Mhm.
but you need vitamin D for good bone strength. And
Right.
so I had all my EDS patients making sure they have adequate calcium, 1,000 milligrams a day,
Mhm.
preferably from diet, and adequate vitamin D, minimum
Mhm.
2,000 units a day. Many of them I had on 5,000 units a day.
You referred to this as the as a defective collagen elastin matrix. That must have been very, I guess, on one hand, a relief to get this diagnosis, but on the other hand, what is the treatment for this, if anything, at this point?
So that's why it's so important to recognize this, because like I said, for infants, right, they're spitting up constantly. You don't want to put them on a medication, right, for what they think is due to gastric reflux, right? You want to be sure that that infant has a wearing a helmet, because if they have easy bruisability and they bump their head, normally a pediatrician will say a little bump on the head's not a big deal, but that infant could be bleeding in
Mhm.
his or her head.
Mhm.
Important. Again, mast cell hypersensitivity. These infants, they kind of look like a cherry almost. They get really red-faced and they don't know why, and they think it's due to an allergy. No, mast cell hypersensitivity. And typically, when it's really problematic, an antihistamine like Zyrtec can help. For joint clicking, I warn both infants, children, and adults, they need to protect them because when your joints are clicking, you're ruining the articular cartilage and you're going to wind up with early onset osteoarthritis. So I recommend soft bracing like athletes use around their, wrists and ankles and knees. And for infants and children, ace bandage works well. And like I said, as infants are beginning to crawl, you need to watch them carefully because they're more prone to falling flat on their face because they don't have the strength and they have poor ligament issues with increased elasticity.
Mm.
Gastroparesis, I recommend smaller meals multiple times a day, even for older adults. It can definitely help.
Mhm.
Um, so there's no so this genetic disorder affects so many of your uh, organ systems, right? There's just no one treatment. You treat whatever organ is being involved.
Mm. That was very, very shocking to see those postmortem photos. And, no one really knows what it looks like in there until, you get to go in there. And this is what happens when you donate your body to research. I mean, I know people who have done this and, they want, it was very admirable of her. And it's wonderful. I want to share the video, I mean, the website of, um, your run here. This is Dr. Holick is going to be, um, they know him as Dr. Sunshine because of his role with vitamin D, and he will come back and we will have that discussion about the vitamin D, the sunshine, and all of that. But today, so here he's going to be running the Boston Marathon, the Race for Spalding Rehab 2025. If you can donate and help to raise funds, this would be wonderful. I think this was. I mean, that's a big deal, though. I mean, and today actually is your birthday, so happy birthday.
Thank you very much.
Yeah.
I joked about it. I said, yeah, thank you for recognizing I'm 59 years old. But oops, no, that's a senior moment, actually 79.
79, and he's running the Boston Marathon. That means we have no excuse, people. Okay, we really need to get our acts in gear.
And you can go to my website, just
Mhm.
drmichaelholick.org, and you'll find this there as well, that for give and gain if you want.
Mhm. Can you see that here?
Yep.
Okay, and it talks about the Ehlers-Danlos syndrome. Am I pronouncing that correctly? Ehlers.
Ehlers-Danlos syndrome. Yep.
Ehlers-Danlos syndrome. Okay. And it gives you all of that information right there. But what's happened, I wanted to ask you though, so I know a little bit something about the family court and what happens in there. And my viewers know that I have not discussed my situation in any detail, but they do know that I have experience with it and involving my kids. And it was always nefarious. I could tell you folks that there's, as you've seen, okay, I'm just going to say it this way, as you've seen, sometimes politics absolutely interferes with medicine. And would you say that's a fair characterization?
Can be, yes.
Yeah. So politics sometimes looks this way. And why are they so hell bent on trying to prosecute parents if there's a medical explanation for something that they present with? And we can't answer that question right now, but it's definitely a problem when you have a world expert on these issues you're a doctor of physiology, of biophysics, of medicine, and pharmacology. And that's just a lot of schooling. It's a lot of education and a lot of expertise. And you have a judge, or you have who is on the other side? Just a prosecutor is trying
No,
to say that,
they
you're
have
not supposed to be making these opinions or something.
no, they have a pediatrician. And often the prosecutor will say to me, so Dr. Holick, are you a pediatrician? And I said, no, but I'm one of the world's leading experts in pediatric metabolic bone disease. And I try to point out to the court that pediatricians, I'm sure, are very good and smart, but they're not trained in metabolic bone disease. So they don't really have any knowledge of this. And they should not be, in my opinion, testifying in court to say that those fractures can only be caused by child abuse.
Right. I mean, how does an infant in utero? I mean, what on earth would somebody do to a mother? Or what could a mother do to cause so many, nothing really, right? To cause all those fractures that we saw in that X-ray.
Right. I mean, basically the mother and the infant would be dead because
Yeah,
they
the
have
mother
that
would be
trauma.
battered. Exactly. The mother
Right.
would be battered. And if they're not addressing that, then they're clearly right.
Right.
So what you're in a battle then. So you're in a battle and you're trying to be vindicated. You're trying to clear your name and saying if I'm the world's leading expert on this and infant and d disorders, you know isn't that enough? I mean, it's not enough to be an expert anymore. I mean, a world's leading expert.
Yep.
So it definitely sounds like politics to me. And this is why I've taken up your cause. And I'm behind you 10,000%, because we have dealt with these issues where kids have been taken away from their parents. And this was something I've been very, very vocal about. And this is something that I'm going to be supporting you for. So I'm hoping that everyone has seen you know what I'll do? I'll include the websites and all the links that you give me. I'll include those in the description section of the video so people know where they can go to find you, where they can go to help you. Now, you said there was another site where they could donate to help you fight this. You have legal expenses up the wazoo. Look, they're doing the same thing to Dr. William Mackis in Canada, who is an oncologist, and he's literally being persecuted for helping people. But it's not, it's not in a politically correct manner. And I think that doctors should be practicing medicine, and you can't have organizations or government telling you how to do that.
So
You
it's
need
on
to
my
use your
website.
judgment. Yeah, you
Yeah.
need to use your
So
judgment.
the donation site on my website goes directly to a GoFundMe.
Okay, let me see if I can find that because I want to show it to everyone just to make sure that they know exactly where to go. Is this it here?
So where it says donate, so
Let me go to the main
you have to
page.
go
Hold
back
on.
to the front
Give.
page.
It says give. I'm sorry. I was
Yep,
looking for the
there you
word
go.
donate. Okay, sounds like. Okay. Here we go. Okay, this is it here. So
Yep.
the question is, what would happen if we didn't have you? I mean, if we didn't have you to come, diagnose us and use your expertise to diagnose clearly. I mean, we're talking, this girl in the trailer said she just wanted to die already. She just wanted it all to end.
Yep.
I mean, this is a quality, this is such a loss of quality of life. It seems like it's a perpetual series of problems. And like you said, you're dealing with one symptom at a time and whatever is giving her the most trouble in all of this or whatever. But are you saying that this is mostly prevalent in females?
So it's, yeah, the symptoms are mainly manifest 70% of the time probably in women. They suffer the most, but
Hmm.
it's an autosomal dominant genetic disorder. So men have equal rights in terms of acquiring it. It's just that for some reason the hormones or whatever in a female seems
Mm,
to really
okay.
exacerbate it
Mhm.
substantially.
And okay, I see. Interesting. And so, like with Dr. Makis, he's had lots of help with people who have been standing up and helping him fight the cause. And I say that when we have doctors that are brave enough to do the right thing and tell the truth, that we need to help them and get behind them. And this is one doctor who absolutely you're not going to stop hearing from me because this is, we have to support the doctors who are doing the right thing. So here it is. This is the website. This is the GoFundMe. And if you can, help support Dr. Holick and his battle for doing the right thing and telling the truth and for medical freedom, because you don't want to be in that situation. The worst thing in the world, the most, very traumatizing event in the world is to have your children taken away from you for no reason. Like it's
Right.
not like you did something
Right.
when you're dealing with very, very conflicting agendas, you're dealing with politics, you're dealing with a lot of things we're not going to talk about today. But I'm telling you, this is horrific and
Yep.
it can happen to anybody.
Yep.
And
Yep.
you think you're doing the right thing by taking your child to a doctor to and find a specialist. You finally get an answer. You finally get someone who understands what's happening, and then you're persecuted. So this is the thing. But I want to also say one more thing. I believe that it is going to be on Trump's agenda to deal with CPS and to deal with their corruption because it is notorious for corruption. And although there may be very well-intended people who are there, there's always good people in even in the FBI, if you believe that. But after we've seen what's come out lately in the news, but it's there are well-intended people who go into it, and the problem is it's the system that is already, established, operating and broken, and they find out sometimes too late. And a lot of people do leave the industry because of it. So this is a problem. This is something that Dr. Holick needs our help with, and we are all behind him 100%. And I would really appreciate if you could share this, give this video a like, and also share it and circulate it. And if you know anybody who you think may have these symptoms and have no answers, nowhere to turn, no one knows how to diagnose them or treat them and doesn't understand what it is, I suggest you reach out to Dr. Holick and see if this is something that you may be suffering from as well, since it's so prevalent. You said between 1% and 3% of the population. So it's not quite as rare as you were saying, as initially thought. Is that correct?
Correct.
Right. So let's see. And this is different. How do you differential diagnose this from osteoporosis?
So osteoporosis mainly means that you have holes in your bones. That means that you have much less bone density
Hmm.
and as a result, the bone is more prone to fracturing.
Hmm.
In this case, many of my patients that were like in their 30s and 40s were having fractures. And that's because, like I said, the underlying structure, the kind of rebar that keeps everything together is much more elastic and flexible. And as a result, the bone is more likely to crack with stress and hence increasing risk of fracture, right? So by definition, if you have a fragility fracture, by definition, they say you have osteoporosis, but it's for a different reason, right? Typically, osteoporosis is loss of matrix and mineral, but many patients have normal mineral, but their matrix is defective, and as a result, it's not structurally sound, and as a result, less trauma can cause a fracture compared to a healthy, normal
Wow.
person.
This is so genius. Oh my God. You must really have a lot of haters who, because you're so brilliant that they'd be so jealous and so feel so jealous of you. And I think that's what happens. I mean, we all do. Like, there's always people who are jealous of someone's brilliance, jealous of someone's, um, you know, expertise and, whatever. But whatever, that doesn't make any difference. That may be playing part of the politics. I don't know. But I'm just saying that you're just brilliant and genius, and I just want to thank you for what you're doing, because
Thank
we
you.
we don't know who's next. And if you want help with if you want to go donate on his site, I'm going to put those links in the description section of the video, and you can check that out there. But you will be coming back, right? We will be talking about vitamin D and the sun a little bit more, right?
By all means.
I hope. Okay. Thank you so much for joining me today. And also, I hope you have a very, very, very wonderful happy birthday. And I look forward to us continuing and doing this again soon.
Thank you very much, Louisa.
All right. To all of our viewers, I want to thank you for viewing. And this concludes this edition of the GoldFish Report.